So let's talk about the aging process. So what is this, right? What does this mean? So this is the process of growing old or developing the characteristics associated with old age. So the process involves increased susceptibility to age related to disease, and then of course a decline in physical vigor. It is known that there's a genetic basis to aging and longevity in different organisms. So in layman's terms, it's just, growing old, right? That's just what it is. All right, I just want to give you the special definition. But that's what the aging process is, right? What's happening, but for the exam, you got to be aware of what's happening physiologically as we grow older, right? What's happening physiologically to the body as we grow older. So that's what you want to understand for the test. So for the exam, you're going to have different kinds of questions where based on the age of the client, you have to be able to apply the aging process, right? So you have to be able to take this process I'm going to go over with you to interventions or choices. So like I said, make sure, right? There's no way you're going to memorize this now, but make sure you're very comfortable, keyword I put in bold, very, with the specifics I'm going to lay out to you that occurs in this process. All right, so let's go ahead and go into it. So let's start first with the baby, right? The neonate. So the neonate is pretty much as soon as they're born, right? As soon as they come out that womb, they're fresh out, right? Within the first 5 minutes, within the first 5 minutes, we're gonna do something called APGAR scoring, right? APGAR scoring. So what is this? So pretty much this is the standard of how we measure the health of the baby, right? So if their APGAR score is low, then they need to go to NICU or for something. So the A is going to stand for activity. So that's going to be is it absent, flex, or active? So when they come out of the womb, are they active? Like, when we look at them, are they moving around, crying? That's why them crying is so important once they come out of the womb. Flex, that could mean they're not really, well, absent means that they're not doing anything. They're not moving, they're not crying. That's really bad. Flex would look like they're not crying, but they are moving their limbs, or their limb is flexed inward, right? And then active is the most healthy one. P is for pulse. So we grade each of them from 0 to 2, right? So absent would get a 0, flex would get a 1, and then active would get a 2, right? And then we add up everything at the end, and that gives you the score. P stands for pulse, right? P stands for pulse, so we're pretty much measuring if the pulse is, normal. G is grimace, so grimace and the reflexes. So this will refer to like their face, like if their face is grimacing, crying, that would be normal. A is for appearance. This is referring to their skin color. So are they blue, right? Are they flushed, or are they pink? So if they are blue, that's a 0, right? If they're not flushed, pale. If they are pale, then that's a 1. And then if they're pink, like they should be, irregardless of what the ethnicity of the baby is, it's always going to be still, full of color if they're healthy. R is for respiratory rate and effort. So meaning, are they not breathing at all? Are they, are they breathing, but it's very shallow and very shallow and short, or are they breathing normally? So pretty much, like I said, we're going to take each of those values, add it up, and that tells us if they're doing good or not. If it's low, right? If it's low, then it's an indication that the patient either needs to be resuscitated or suctioned, or well, yeah, suction or resuscitated. But if it's high, then we can go ahead and send them to they can go ahead and go into the arms of the mother. So there are specific sizes or vital signs, right, when it comes to the baby. The normal physical size for a healthy baby is going to be about 18 to 21 inches, which is equivalent to 47 to 53 centimeters. Here's what I'll say. I don't know if the exam is going to give you this information in the form of centimeters or in inches. It could be either one. I can't say that. So that's why I'm giving you both, right? So you're just, so you know. So we got 1821. The chest circumference is about 12 to 13. Head circumference is 33 to 35. Their birth weight is 2,700 to 4,000, which is about 6 pounds to 9 pounds. Vital signs is looking good here. So vital signs, vital signs, the vital signs of a neonate is higher than that of an adult, right? It's much higher. So you have to bear that in mind when we're checking the vital signs of a baby. It's not the same as the adult. So our respirations 30 to 60, our pulse is 100 to 160. Our blood pressure is but the blood pressure is lower though. All right, so the blood pressure is going to be so here's the thing. Why is the blood pressure lower? All right, so you should be thinking to yourself, okay, what is the pathophysiology of why it's lower? Because that's going to help you to get out of the habit of just memorizing it and then being more likely to forget it, right? Anytime, one thing I've learned is that if you know the why, you're more likely to remember it. Write that down, right? If you understand the why, you're more likely to retain it. That's why a lot of people, can memorize, but they don't know the why. That's why they can go through the book, but then forget what they just learned because they don't know the why. So here it is. It's a baby, right? Because they're smaller in size, they don't need as much blood volume, right? Their blood volume is smaller because they're smaller in size. That's why and so as a result, the pressure is going to be lower, but it's still normal. So our systolic blood pressure is 60 to 80. Diastolic is 40 to 50. Temperature can be anywhere from 97.7 to 98.9. All right. So just like I said, screenshot this if you can. If you can't, then just write it down again later when you go through the recording. Skin changes. Okay, skin changes. Oh, here, let me give you a second. All right, so just screenshot it really quickly for those of you that are screenshotting it. 1, 2. Okay. All right, skin changes. So this is what we'll normally see as well once they come out of the womb. They're going to have something called vernix caseosa. All right, vernix caseosa. So this is pretty much like a thick, cheesy substance over their skin. Right? So they have that, that it's like a thick substance over their skin. That's normal. They have very fine hair, right? It's very thin, which is called lanugo. They may have small red spots on their skin. All right, this is all the skin. That's called milia. All right, that's called milia. They will have, bear with me, I'm going to say this well, telgiantic nevi, which is also known as stork bites or pink spots. I'm going to show you in a little bit. I'm going to show you what these things look like some pictures. The spots is going to be on their face, their neck, their eyelids, their upper lip, the back of their neck, their forehead. They're going to have purple, or they can have purple, blue Mongolian spots and port wine stains, which is called nevus flammeus. And oftentimes they're seen on the back, the buttocks area for dark-skinned infants, but they normally go away by the time that they're in school. The port wine stains, just remember, the port wine stains, they're much more, I want to say distressing, right? Like, I'll show you what I mean by this, especially if they become permanent, okay? So this is what it looks like. Here's what it looks like. Over here on the left-hand side, remember I talked about the Mongolian blue spots, which was, let's see, the purple Mongolian blue spots. Okay, so over here on the left-hand side, you see how it's like, like I said, it's on their back, their lower buttocks area. Then this one over here, they got that stork bite, right, on their face. Normally it goes away. It goes away though. Then over here at the bottom, where we're showing you the eye, the baby's eye, you can see it. Like if you look really closely, it may be hard to notice it, but if you look really closely, they have like these tiny, very tiny white spots around their eye. That's Mila. So it's kind of like, it's like these raised white bumps around their face, right? And they can go away though. And then over here on the far right, you see that port wine stain, right? So you see how, like I said earlier, like it's very distressing, right? If it doesn't go away, because it's not something, it's something that's, obviously very noticeable, right? Very, very visible. Excuse me. So these are what all those things look like. Like I said, it usually goes away, on its own, but that's what it is. So just be familiar with what these are. Then you have GI changes. So this is the changes that they experience in their GI system. For one, the neonate, the abdomen is normally round. All right, so the abdomen is normally round. You should hear bowel sounds within a couple of hours after they give birth. All right, so there should be bowel sounds. The umbilical cord and site should be free of any infection, right? So there should be no redness. There should be no pus. The neonate, their abdomen moves up and down with respirations. Why? Is because neonates and infants, they're more abdominal breathers, right? They're more abdominal breathers. So you just want to remember that for the test, right? Is that neonates, they're more abdominal breathers. Neonates also, they will usually pass something called meconium. And meconium is like a sticky, black, but yet odorless, sterile stool within the first 24 to 48 hours after birth. Okay, so if they don't pass the stool, then that could be a bad thing. That's a bad sign, and we need to assess them further. All right, we need to assess them further. So these are all the GI changes, right? So no infection around that umbilical cord site. We should hear bowel sounds. They're gonna breathe using their stomach, and then they should pass something called meconium within the first 24 to 48 hours after birth. Then we have sensory changes. So with the neonate, their eyes are bilaterally equal in terms of their size and shape. All right, their eyes are bilaterally equal in terms of their size and shape. And then the red and the papillary reflex are present, and normal smooth eye movement should be apparent. Okay, so that's what it is with their eyes, right? So they should be able to move their eyes normally. Their ears, though, are going to be normally placed bilaterally, and they should have with firm and well-formed cartilage around their ears. They should be able to hear sounds and noise. Now, if the ears, though, are more low set, as well as the eyes, then that probably indicates that they may have Down syndrome, right? So that they probably have Down syndrome then. So those are the signs and symptoms of, those are the sensory changes or the sensory normalities of the neonate. Then you have the infant, right? So now we're going to move on to the infant. So the infant is now, with the infant now, the infant is going to gain about 5 to 7 ounces during the first 6 months of life, right? And then they'll double their birth weight during the first year, right? So the infancy stage this is going to be within like the first 6 to 9 months of them being born. So you want to know that it's normal for their birth weight to double in size, right? It's normal for their birth weight to double in size, especially within the first year. Their head circumference is going to increase by 1/2 inch each month for 6 months, right? And then 2 months of an inch until the infant is 1 year of age, right? So each month is for 6 months, it's going to increase by 1/2 inch, and then after that, then it's going to be by 2/10 of an inch. The infant is in what you call the sensory motor stage, which is based on another type of stages of cognitive development by Jean Piaget. And then, so that's for cognitive development as far as how they think, function. Then you have Eric and Erickson's stages of development. So this is trust versus mistrust, right? That's the stage that they're in now, right? They're in that trust versus mistrust stage. So with the infant, they begin to see self as separate from others. The infant also, they're the ones that's experiencing separation anxiety, and then also the fear of strangers. So that's why, like as far as with nurses or nursing care, right, they're not going to feel comfortable around the nurse all the time because they're developing that fear of strangers as well, right? So you got to be familiar with, like I said, trust versus mistrust. All right, these are what you were expecting at the infancy stage.